I've been a dentist for 13 years and I run my own dental practice in Switzerland. Until a couple of weeks ago, I thought I had seen everything, but clearly not. A couple of weeks ago, I had a patient whose treatment was covered by insurance. According to the insurance requirements, the plan was very strict. All teeth had to be removed in one single appointment and a full denture placed immediately. We waited almost 3 months for the approval. And once the plan is approved, you're not allowed to deviate from it. On that day of the procedure, as always, I asked whether the patient was taking any medications or drugs and whether anything had changed. He said no. I started the anesthesia and almost immediately realized it wasn't working properly. I asked again, and that's when he said no, because he's a good boy. He doesn't use drugs, only marijuana and cocaine. But according to him, those are not drugs. At that point, I already wanted to stop the procedure and replaying everything. Technically, the maximum allowed dose of anesthesia would have been enough for just one tooth. I tried to distribute it across everything, but obviously it didn't work the way it should have. The patient started demanding that we continue the same day, saying he wasn't living without his denture. His condition kept changing constantly. He was yelling, screaming, threatening, showing his face, and a minute later he was praising me, joking and laughing. In the clinic, it felt like a performance. The patients were coming out, looking at me strangely and asking what on earth was going on. Toward the end, when he noticed how exhausted I was, he even kindly offered to help, saying he had something that could help me. In the end, we stopped after removing 5 out of 6 teeth. One root was left for later, but according to the plan, a full denture was placed and he left the clinic that same day with his denture. And the most absurd part, after all of that, he was happy and later turned out to be one of my most grateful patients.